Okay, so we are talking feet, and more importantly, or more specifically in this session, about plantar fasciitis. So plantar fasciitis is a really common thing that I treat in clinic. So what is it? The plantar fascia is a thicker part of fascia that attaches or creates stability at the sole of your foot. So let's think about this. Fascia is the connective tissue that goes through the whole of your body. It attaches to every muscle, ligament, bone, organ, every vessel, every artery, nerve, etc. Everything is held together with this fascia. And in a lot of places it's very thin, it's almost like a cling film connecting to everything, but on the sole of your foot it is a lot thicker. And when we think about what sort of tensions we put down through the feet, whether you are just generally walking, or you're a runner, you're in intensive exercise, you're putting intensive exercise through there, or you just spend a lot of your time on your feet throughout the day, the whole of your body weight is going down through that fascia in your foot. And bearing in mind, we need to maintain a little arch through the foot, which the plantar fascia is involved with. You know, there's a lot of weight going down through there, basically, is what I'm saying. So what can happen over time, and let's face it, footwear is the big key to this, and I'll address that in a second. But what is essentially happening is the forces that are going down through your feet are creating almost like a repetitive strain, sort of pulling movement on the attachment of the fascia of your foot. So this fascia starts thickest at this, if I use my hand as the foot, so at your heel, it's the thickest attachment here, and then it sort of fans forward. So it tends to be that when people get plantar fasciitis, this bit at the back of the heel tends to be a really intense sort of, almost like they say they're standing on a stone all the time. And it can be worse when you're getting up in the morning, that sort of initial half an hour of the day, trying to put the heel down, once you're getting your ankles moving, that's like kind of the most intense and awkward pain. Sometimes it can ease off through the day, but the more chronic this condition gets, the more pain you're going to get throughout the day. Now, I mentioned footwear. So this is the first bit of advice that I tend to give people, is first of all, look at what they've turned up to me to the appointment in. And if they've come in a pair of flip-flops, you kind of know where this conversation is going. So basically, your foot needs a stable support around it. And I'm talking while you've got inflammation of this plantar fascia, especially. What you want to look at is if you are walking in your shoe, and as you lift your foot off the ground, if the shoe doesn't come attached to your foot, then what's essentially happening is the sole of your foot is going to have to work really hard to keep the shoe on. So if we talk about flip-flops, okay, when you lift your foot up of a flip-flop, you tend to lift and then you curl your toes to flick the flip-flop, get my teeth around that, to come back up onto the sole of your foot. It's kind of why they're called flip-flops. So you're putting your foot down, it's flipping back up, foot goes down, and each movement you make, every single time, whether you notice it or not, your toes are constantly doing this in order to flip the back of the shoe back up again, and that is constantly creating tension through the sole of your foot. Now take that into a shoe like a trainer, where you don't even have to think or work hard. Your foot can stay relatively relaxed in that position. As you roll the weight through from your heel to your toes, the shoe comes up with you because everything is encapsulated within that shoe. So it's taken a lot of tension off the sole of your foot. So the number one thing is make sure you have got good supportive shoes. It's not necessarily just the flicking of the shoe. If your shoes are very unstable, they're maybe very wide, you know these sort of ballet pumps that people wear, and I know you'll probably see me wearing them sometimes, but not all the time. It comes down to what your foot's in most of the time. It's all right to go out for an evening in some soft ballet pumps, but if the majority of your working day is in them, that's going to start to cause an issue. So make sure it's a good connective shoe, something that's holding your heel and your ankle and your heel into place. So what can you do if you do end up with plantar fasciitis? So it's an inflammatory condition. We need to get the inflammation to go down. So initially, ice packs, things like that. And ice packs are not always the easiest things to sit with on your foot, so sometimes I suggest your hand washing bowl, stick some water and some ice cubes in it and pop your foot in there to get that initial inflammation down. There can be some cause for using anti-inflammatory medication. That's not something as osteopaths can recommend, but you can speak to your GP about using something like anti-inflammatory medication. And then we need to look at the stability of the ankle, how the whole mechanics are working through pelvis, knee, ankle, making sure that you're not walking awkwardly or specifically limping one side to the other. This may be something else that's led on to it. So that's something as osteopaths can do to make sure the mechanics are working fine. But then for you to do exercises for yourself, we need to do gentle load bearing exercises. So one of the exercises that we recommend for people to do, it's a little bit helping through the plantarfacitis, but mainly looking at the ankle stability, and most specifically that tension that's coming down through the Achilles tendon into the ankle. So picture this: get yourself standing on your bottom step, so you're facing up your stairs. So have your hands resting on your wall, your banister, whatever you can grab hold of just to stabilize yourself. Your toes are going to go on the bottom step and your heels are going to hang off of the bottom step. And basically what you're going to do is you're going to come up onto your tiptoes and then lower your heels all the way down and underneath that step, gently coming up. So you're building that tension through the back of your calf muscles, and then gently lengthening it under pressure. So you're lengthening through that Achilles. And then from there, you can walk on the spot. So you're lowering one heel down and then lowering the other heel down. So you're walking on the spot, getting that tension to release through there. Other things that you can do if it's really stubborn, especially if you have been suffering with it for longer than say 6 months, and whatever you're trying to do, it's still not working. That is when we use our super amazing gadget, the Shockwave machine, and that is specifically designed for chronic injuries. And when we say chronic, we're talking in terms of length of time you've had it. So if it is longer than say sort of 4 or 5 months, we tend to now call it a chronic injury rather than an acute injury. So what we'll basically do is use the Shockwave machine into the plantar fascia tissue itself. The Shockwave puts sound waves that travel deeper down into the tissue to help create inflammation. So we're basically stirring up the injury, but it's allowing the healing process to restart and to regenerate those connections through the fascia to release off any tension. When we use Shockwave, it's not a one-off session, unfortunately. We say realistically in the first instance you use it 3 to 5 times, with around a week's gap between each one. Quite a lot of the time when we use this, you don't tend to notice too much of a difference between the first and maybe even the second, but by the third one and definitely the 4th, 5th, you are starting to notice a significant difference through that plantar fascia. So if you want to know more about that, then obviously get in contact. We can get you in for an assessment and be able to tell you whether that's the right course of treatment or whether there are more things that you can do to help yourself. So I hope that has helped. If you have any other questions or would like to know more about how to manage anything that's going on through your feet, then please do get in touch and we're more than happy to help.